Hi guys, welcome to Agni Nursing Academy. I am Prakash Kurki. Today I am going to discuss about some important questions which are can ask in the NORCET, RRB, SGPGI upcoming examinations. Okay, first I am going to discuss first nursing foundation questions which are the previously asked questions. First, move on to the first question, that is IV set should be changed or discarded. In this question, they discussed about the IV set should be changed after how long? Okay, after how much time you used? Okay, according to CDC and WHO guidelines, we have to follow CDC and WHO guidelines only. Okay, almost all the hospitals following these guidelines only. Okay, first one is if you are using a IV set continuously conti continuously means you can use up to 72 hours. In ICU, IV set continuously they will infuse the IV fluids. That time you can up to use 72 hours. Okay. And second one is intermittent. Intermittent. Intermittent means for drug administration or IV bolus, you can use up to 24 hours. After 24 hours, you have to discard that IV set. This is updated guidelines given by the CDC and WHO. That is, if you are using fluids continuously means you can up to use up to 72 hours. That is 3 days. And second one is intermittent means up to 24 hours you can use one IV set. And answer of this question is 24 hours. That one intermittently, most commonly you will use intermittently. So answer of this question is 24 hours. If they asked particularly in continuous means you can use 72 hours. Now according to this question is 24 hours. Okay, remaining are wrong. And one more point I want to discuss here, that is TPN bag, total parenteral nutrition bag. TPN bag, how much we can use? We have to discard after 24 hours. After 24 hours, if you use that TPN bag means bacterial growth will happen, that can cause infection. So TPN bag should be discarded after 24 hours. And second one, gravity enteral feeding. Gravity enteral feeding bag. This bag should be discarded after 24 hours only. Okay, after 24 hours we have to discard this bag also. And one more BT set is there. Okay, blood transfusion bag, BT set. Okay, this one we have to discard after 4 hours. 4 hours or after completing blood transfusion. After completion of blood transfusion or after 4 hours we have to discard this BT set. Okay, answer of this question is A. Okay, move on to the next question. This question, a nurse observed that SpO2 of child on ventilator is decreasing and ventilator is indicating high pressure alarm. Tidal volume, low tidal volume, and what should nurse do on priority? This is priority question. Okay, this is the priority question, and in this question, that ventilator showing high pressure alarm. High pressure alarm. Then coming to the ventilator concept, alarm concept. A ventilator is here, one ventilator is there, and here our patient is there, and from this ventilator you are ventilating the patient. Okay, this is the closed circuit. Okay, if anything happens means it will happen in this closed circuit only. See, if ventilator alarm system is one is high pressure alarm, high pressure alarm, and second one is low pressure alarm. See, high pressure alarm, it's happening means in this circuit something happen, like obstruction happen. This most common cause of high pressure alarm is obstruction. In this closed circuit uh, obstruction happens means ventilator shows high pressure alarm. If obstruction happens in most of the conditions, most common cause of the obstruction in the this circuit is secretions. If venti circuit obstructed means most commonly it is caused by the secretions. Okay, if secretion filled in the circuit or tracheostomy tube, we have to do suctioning. If we clear that airway means this alarm will off. Okay, and next one is low pressure alarm. Low pressure means in that closed circuit something happened, that is like air leak. Most commonly air leak will cause the low pressure alarm. Now air is leaking from the circuit. What we have to do means observe for the any leakage. Observe for leak or tube disconnection. Okay, if tube disconnection means what we have to do, we have to change or connect reconnect the tubes. Okay, clear. Now coming to the options. Ventilate with the ambu bag, attaching it to the attaching at the end of ET tube. See if it's showing high pressure alarm and cause is secretion, then we have to go for the suction, not for the oxygen. Okay, patient can maintain that. Okay, now priority of this question is suction. Priority answer of this question is suctioning. Okay, don't go for ambu bag, we can do it later also. Okay, answer of, so while option A is wrong, then option B is the correct answer of this question. And option C, what they are selling, replace the venti tube. See, here obstruction happened, we can resolve it by the suction, so no need for replace. So if air leak happens, tube is disconnected or something happened, damage to the tube means we have to replace the ventilator tubings. So this is not the answer. Ventilate the patient with the NRBM. So this is also not answer, not the answer. So this is the low flow O2 device. Okay, low flow O2 device. Answer of this question is immediately perform suctioning. Okay, move on to the next question. What is the size of suction catheter used for the 60-year-old adult? See, in this question, they given the age of the person and they are asking the size of the suction catheter. So I am discuss about the this size and age of the according to age I will give information, that is if a person is infant, we can use 6 to 8 French. Okay, and 6 to 8 for infant. For children we have to use 10 to 12 French. For adult female also separate, male also separate. Okay, this one 12 to 14 French. Okay, 12 to 14 we can use for female adult. Okay, for adult male 14 to 18 French. Okay, 18 French for adult. See, according to this question, they given age of 60. 60 is an older adult. So we have to use 14 to 18 French suction catheter. So coming to the options, 8 to 12 French we can use for children's, and 14 to 18, this is correct answer of this question. Correct answer of this question is B. Okay, this is for adult. Sorry, adult. And 20 to 24 and 20 to 24 and 24 to 28, these are the large size suction catheters, it won't go through the suction, so sorry, tracheostomy tube. Okay, not recommended. So answer of this question is B, 18 to 12 to 14 to 18 French. Sir. Then if they given here same question, if they given 6 mm ET tube or tracheostomy tube, now they given endotracheal tube size. Okay, 6 mm size you have a tracheostomy tube. Now you have to choose how much suction catheter size. So one formula is there. According to that formula, you can select the suction catheter. Okay, that is suction catheter equal to size of tracheostomy or ET tube into 2 minus 1. This is the formula. See, if the ET tube is 6 mm, 6 mm multiply into 2 and minus 1, 12 minus 1 is equal to 11. Now suction catheter we have to use 11, but in clinical setting we don't have even odd number size, don't have odd number suction catheter. Suction catheter will be 5, 6, 8, okay, 10, 12. Now for this 6 mm endotracheal tube we have to choose, if it is 11, now we have to use lesser one, okay, smaller one or smaller one is 10. So we have to use for 6 mm ET tube we have to use 10 French suction catheter. Okay, understood? Remember this formula, ETT into 2 minus 1 and go through the smaller one. So answer of this question is B. B is the correct answer. Okay, move on to the next question. What a nurse should do if central line dressing is soiled? In this question, the topic is central line dressing. Okay, central line dressing. This is the sterile procedure. Sterile procedure. So we have to follow the sterile techniques in this procedure. So coming to the options, notify the doctor, change the dressing and do dry cleaning dressing, inform to the senior nurse and change the dressing with aseptic sterile technique. So one by one we will discuss the options. Option A is wrong. This is not the answer. So no need to inform the doctor. Then coming to the option B, change the dressing and do dry cleaning dress. So this is the sterile technique. So and what they told, change the dressing and do dry cleaning. So dry clean dressing. So this is also the wrong. It is the sterile procedure. And inform to the senior nurse. So if you inform to the senior nurse means they will again give more work. So no need to inform senior nurse. Now coming to the last option, change the dressing with aseptic sterile technique. So this is sterile procedure means we have to follow the sterile aseptic sterile technique. So answer of this question is right. So option D is right answer. Then coming to the CVP dressing, what are the types of dressings we have to do and how much days we have to maintain the dressing and how time we have to change that dressing. In CVP dressing there are two types of dressing. One is gauze dressing and transparent dressing. If you have done with the gauze dressing, you can keep up to 2 days. Okay, if you are done with the transparent dressing, you can up to 5 to 7 days. 5 to 7 days you have to keep transparent dressing. Okay, and cleaning the site with how you have to clean the site of insertion. You have to clean with the 2% chlorhexidine chlorhexidine gluconate. 2% chlorhexidine gluconate in the from circular manner like this, from low area of infection to high area, like you have to in the circular manner. Then answer of this question is D. Sorry, answer of this question is D. Then move on to the next question. What is the role of the nurse after assisting in central line catheter insertion? See, they are asking after central line catheter insertion. Okay, after. Don't confuse with the procedure, intra-procedure, pre-procedure, and after the procedure. So after assisting the central line, then coming to the options. Secure the catheter with the aseptic technique. If already this option is coming under the procedure, inside the procedure, we have to secure the catheter with the aseptic technique. So this is not the answer. Flush all the ports of catheter. See, if you are not confirmed the position of the catheter, do not flush not flush anything into the catheter. It may cause a pneumothorax or hydrothorax somewhat. Okay, this is also not answer. And call for X-ray and assess the line position. I'll discuss this one next. Do dry and transparent dressing. See here, this is the sterile technique. Already I told in the previous question, this is the sterile technique. So no need to do dry transparent dressing. Okay, this one sterile technique. So coming to the option C, X-ray to assess the line position. Yes, this is the answer of this question. So if you insert that in central line catheter, after that we have to confirm the position with the X-ray. After that only we have to flush the all port. The answer of this question is C. Answer of this question is C. Then move on to the next question. On assessment, a nurse get apical pulse of patient 80 per minute and radial pulse 65 minutes. Identify the pulse deficit. In this question, they asked pulse deficit. Why it happens? Where it happens? In what are the conditions it happens? Means in this like shock, and heart failure. In these conditions, this pulse deficit can happen. Okay, how we have to calculate the pulse deficit? There is a formula: pulse deficit equal to apical pulse minus radial pulse, or central pulse minus peripheral pulse. Okay, don't confuse. Here the apical pulse they have given 80 per minute and radial pulse is 65 and answer is 15. 15 beats are lesser than central pulse. So answer of this question is B, 15. Sorry. Answer of this question is 15. Then coming to the next question, that is how much dose of atropine can be given in case of bradycardia according to AHA guidelines, American Heart Association guidelines. See, this is the bradycardia. This is the case of bradycardia. If a patient, bradycardia. If patient getting bradycardia means we have to observe for some conditions or some we have to assess some conditions like hypotension and level of consciousness, or we have to observe for the perfusion And we have to observe for the heart failure conditions also. It may be also stroke also. Stroke also we have to observe. Okay. Then coming to the bradycardia DOC. DOC for bradycardia is atropine. How much dose we have to give? In this question they asked the dose only. Okay. In previous guideline that one 0.5 mg. Now new guidelines is 1 mg 1 mg bolus, and we can repeat after 3 to 5 minutes. After 3 to 5 minutes we have to repeat if the condition become worsen. And how much dose we have to give? Maximum dose will be 3 mg. Okay. Now understood. Answer of this question is B. Answer of this question is B. Okay. Thank you. I will come with the